Hi guys, I'm Jeremiah. This is Dr. Bruce. You met him before. We're at Bridge Integrative Medicine today, and we're going to look at a PRP, how we prepare PRP, all those types of things. So let's go ahead and get started. So Dr. Bruce, why don't you tell me a little bit about what PRP is?
Platelet-rich plasma.
Yeah.
So your body gets a lot of healing factors to whatever tissue is injured, mostly inflamed, right? We need a signal somehow, and inflammation is a great signal. And so what we've got here is we have a patient with a, boy, the squeamish better look away, huh?
Yeah.
What do you think?
Yeah.
So we have a patient that came in and said, hey, I'm getting a lot of signal, so this is a lot of pain that she was dealing with. This was a hip and what else?
Hip and knee.
Hip and a knee.
Yeah, we're going to do a hip and knee injection on
Yeah, so basically what Corey's doing now is making sure that the blood started, that it would come in, and we're using the patient's own blood to, all of the healing factors that are in your blood happen over a period of time. And so our goal is to get that, let's say the concept would be take 3 weeks of healing factors and dump it into the system immediately.
Yeah, so it's concentrated.
Yeah,
concentrated
and it's very quick.
Yeah.
That's the thing. It's not like concentrated, but it's very fast,
Yeah.
So instead of taking 3 weeks to slowly go through and dump all of these factors, this is something that will happen very, very quickly. Outside of the bloodstream where all those platelets are, they're inside of a tube, your own blood vessels. And so when it runs into a place it doesn't realize, it dumps all of its healing factors at once. So she's got a nice 22 tube there. That's Corey. She's amazing, very talented nurse practitioner. And so we take the actual blood, the raw blood, and it's got to balance, you got to balance things, everything just perfectly. And this particular company gives us all of the tubes and things that we need to balance.
Is that centrifuge? Is that what she's using?
Yeah, centrifuge. Yeah, and there's a very specific thing. I always thought it was RPMs before we started doing a lot of this stuff. It's not. It's actually G. It's actually gravity. Really? Yeah, they actually look at it an amount of gravity that it actually pulls. And so our goal here is to we spin this down.
There it is. Yeah, the RPMs have showed up on there. 3,500.
Yeah, and it actually shows up as 3,500, but it's set on a very specific G. How much gravitational pull it would have, so that it separates it perfectly. It takes about 10 minutes to do this one.
So is that because the blood, your red blood cells are heavier than the plasma?
Actually, it's because it has a very specific gel that's in there, and it is a very precise gel. So it takes all of the red blood cells below. If you were to just inject blood into an area, it would be horribly painful, right? It'd be like you bruised it.
Yeah.
And beyond the pain, it would also, there's a lot of toxic values that would happen there. You really don't want to put blood in an area that it doesn't belong. The platelets would be there too, but that's not good. Okay. In this case, it takes that very specific gel from this company, allows for all of the red blood cells and actually all of the white blood cells except for monocytes. So in the presence of monocytes, platelets have a completely different secretory profile. So what you get is I love that she explains this. She's so good. You almost want to hear her in the background, right? But so they have a different secretory profile. Their job then is just growth and healing. That's all it does.
Okay.
And so what you're getting now is platelet poor plasma at the top, platelet rich plasma in the middle, and she's probably described all that. That gel is very specific to pull all of the red blood cells below it, and then all of the white blood cells that are not useful for this particular technique. Yeah. By the way, one of the knocks against platelet-rich plasma, PRP, is that it was really painful. They've been using it in athletes for a long time, but the athletes were like, I have to be able to use this body to play, and they would heal very, very quickly. Have you ever pulled a hamstring?
Yeah.
Yeah, right?
Yeah, it's not fun at all.
No, right, and it's months before you heal, right?
Yeah.
Yeah, so now here comes the vent needle. This is all a really good technique. She does a great job. You put a vent needle in, so obviously some air can come in, and then everything is sterilized. Then it's also a filtered tube. You need to know that there's a filter on that tube. It comes all in a kit. Tropocells does a kit for us, and it's great. It really keeps it's an easy button, it's an entirely enclosed kit, works really, really well.
So what's she pulling off the top there?
Platelet poor plasma. This also has orthopedic application.
Does it?
Yeah.
Okay.
That for some people, platelet poor plasma actually works, and then you also get the very fibrin rich. That's also happens in certain applications for tendonitis, tenosynovitis. That's another really good one. For this orthopedic application, you really just need the platelet rich plasma, because when that comes into contact, the monocytes, it's already in the contact with the monocytes right now. As it gets injected back in very quickly, notice she sterilizes everything. Isn't that cool? She sterilizes and filters every single step of this. None of this has a chance of causing a problem. It never has. For us, it never has. But, you know, it's kind of hard to mess it up. Everything is absolutely aseptic technique, and this is how she trains, too. She's one of our trainers. That's how Corey trains, and she does a great job here.
So she's getting ready to pull off the PRP. What's she doing with tilting that tube back?
It's got a little bit of a thinner in there. It's the easiest way to describe it. You want to mix everything through very well so that you get it nice and spaced out. And then once you do your draw off, you want to make sure that you get an amorphous solution, a homogenized solution, so to speak.
It's really cool that gel's there. It's really keeping all those red blood cells that you said separated.
And the white blood cells that would be painful, right. Yeah, there's not going to be any in there. And then she's got 2 applications she wants to do. Obviously a knee, which doesn't take as much, and a hip, a very large joint. So you want to get as much in that area as you can. And I always say the concept is basically it would take 3 weeks for your body to put enough of this information and energy, healing energy, into an area where this is going to happen in literally hours. Yeah. So it gets you. You always said you could get over a hump, right? If you could just get past the hump, it's like, I can't tell you how many people have tendonitis or some kind of a bursitis. There's a lot of applications for this, but would have a real problem. And if the person would just say, my healing just can't seem to catch up. It's like when you're a kid, your healing factors are so strong and they do so well. And then as we get older, it seems to diminish.
So that bigger tube, that's the one she's going to use for the hip this time? Is that what that's for?
Yeah, the biggest draw would be for sure the larger joint. That's the goal there. And we like to use that for the hip because the knee holds stuff together really well. And the hip has a tendency to be harder to get into an area and have it hold there. And then, of course, they're going to they've already gone through all of the consent and all of that. Look at that, boy, she got one big one and one small one out of that 22. And that is the platelet poor plasma, which really does have great orthopedic application, but we're just not using it for this particular one. So those would be, all the air would go out of them, and she would inject them back in to that area. And the relief is very quick. We're really impressed because in platelet-rich plasma in the past is painful, and that's been a real problem with it. So people would, for 2 or 3 days, you could even get a pseudo-infection feel to it, which is really swell up really bad. And the people get over it, and then after a while they're like, hey, I'm actually feel like I'm healing better. But in this particular case, we've got none of the white blood cells or red blood cells that are in it. Because of that, that's a very proprietary gel. We like to use the best one. I call this platelet rich plasma 2.0.
Yeah,
it really is, and it's great. The miracles of modern science. I mean, I didn't make this up. These are things that they're honestly just doing better and better. It's like every year, hey, this works well. This works well. It did. It worked well, and now it works better. So. Yeah.
What are some applications for this then?
Tendonitis is probably the most the common one that you see. Everything from remember we have patients that can't pick up a coffee cup. They'll get like this, it works incredibly well for that. It works very well for the orthopedic applications, pain in knees and so forth. It is truly regenerative. It actually will change the macrophage from an M1 to an M2. So an M1 is, think of that as a very excited macrophage. It's just trying to close a hole, guys. It's like, I'm really injured, I've got to fix something. And then the M2 is one that's growth and healing. So you would get the M1 happening first, and there would be an amount of that would happen. Just think of it as an amount of that happening. And then slowly, once the hole is closed, because that would be a very bad thing, once the hole is closed or the injury is beginning to heal, M2 slowly filter back in and they start to cause healing or regeneration of the tissue. This allows to put the huge amount in of M2, and it actually shifts it. It actually shifts the inflammatory cascade over to a healing and growth, because it has lots of things that are designed to do exactly that, as opposed to close the hole, right? Yeah. So in orthopedic application, you don't need to close the hole, right? You would need that if you were to cut yourself, and the body doesn't know the difference. So we're basically hiring all these mercenaries
to come in and do it for us.
To not close the hole, to actually heal and grow. And By the way, it's also important to note that they have a totally different secretory profile. Cytokines are different. They create different enzymes. But it's actually good for you once you've had this in you to move, to actually move it through the joint, to exercise and move, which is very different than some of the other applications there. And it doesn't melt stuff like a steroid does. Steroids unlink proteins. We've known that forever. You do it if you have to, right? But if you don't have to, this is a whole lot better application for that.
Well, thank you for coming and sharing that with us today, Dr.
Oh, it was fun, man. I really like this stuff. This stuff has done very, very well for our patients. Yeah. So it's an easy button, you know? And it takes some talent, takes some time, but we certainly have people that can show people how to do it.
Yeah. Now that's something we can buy. You can buy in our office, right? You can come in and have that done in our office and all that.
Oh yeah, that's your job, man. You're the one that gets it. Yeah, but that's exactly right. Yeah, right. No, that's exactly right. Yeah, we do that for these applications. Most recently, talk about my friend Scott. He can't do a surgery on his foot, right? So he has a really bad heel spur, so his bottom of his foot is horribly inflamed. And a great guy, just a great guy. And he had a cardiac problem, and so his cardiologist would not release him to have the surgery that honestly we both agree, and his orthopedist that we're working with agrees that he kind of needs. So he says, well, how do I play golf between now and then? And I said, let's give this a shot. He said he had 85% reduction in pain in about 2 days.
Wow.
From this. So it is healing, it is growing, it is very, very helpful. And of course, in that particular case, we're working straight with the medical docs there and our nurse practitioners to eventually get him to where he can solve that problem permanently. This, however, is it's the best I've seen for if you don't have something that's horrific. Yeah. You can actually solve a problem here, which is awesome.
Well, thanks, Tim, for meeting with us.
Yeah, it's awesome, man.